Good day, everyone. We are the Group 4B of BSN 3C and we will be presenting our research topic, Level of Preparedness in Clinical Risk Assessment and Management Among Nursing Students. Together with me are my group mates, Ms. Patricia Pakingking, Mr. Ken Sambrona, and Ms. Mae Sayson. For the background of our study, the capacity to recognize and manage risks successfully in clinical settings is one of the fundamental qualities nursing students must learn during their training. Patient safety is of utmost importance in nursing practice, which is intrinsically complex. This study will determine the knowledge of nursing students responding to different risks during clinical exposure. The research may identify the capabilities of nursing students in handling possible errors that could harm both them and their patient. For our objectives, to obtain all the essential knowledge, data, and information, this research specifically answered the following. Number 1, what are the demographic profiles among the nursing students in terms of age, sex, and number of clinical exposures? Number 2, what is the level of preparedness of nursing students as a whole and in terms of clinical safety, culture of safety, working in a team, communicating effectively, managing safety risk, understanding human and environmental factors, and recognize, respond to, and disclose adverse events and close calls. And lastly, number 3, is there a significant difference in the level of preparedness when grouped according to profile as a whole and in terms of clinical safety, culture of safety, working in a team, communicating effectively, managing safety risk, understanding human and environmental factors, and lastly, recognize, respond to, and disclose adverse events and close calls.
As for our research design, the study employs a descriptive quantitative research design and utilizes a modified questionnaire. This approach provided insights into the students' readiness and competence in clinical settings, highlighting their overall preparedness for real-world clinical environments.
For the participants of the study was the fourth-year students currently enrolled in second semester academic year 2023 to 2024 and have exposure in special areas. To calculate the sampling size, Cochrane formula was utilized using a 5% margin of error. By using the formula, the sample size of the study indicated was 157 level 4 nursing students. Then, we used the stratified random sampling method to obtain the correct sample size to each sections.
The instrument, the researchers used the HPEPSS survey to assess nursing students' patient safety competency, focusing on areas like effective communication and safety risk management. The survey is based on a competency framework and used the Likert scale.
Now let's have our results and discussion. For the demographic profile, the researchers found out that majority of the participants were 22 years old. Most of the participants were female with a percentage of 76.4, and lastly, most of our participants with a percentage of 65% have a clinical exposure ranging from 21 to 25. For the level of preparedness, the nursing students have a very high level of preparedness in terms of clinical safety with a mean of 4.55. As a whole, the level of preparedness of nursing students is high with a mean of 4.34.
Next is the differences in the level of preparedness as a whole and when grouped according to age. Using the Kroskal-Wallis age test with an alpha of 0.05, the results indicated that there is no significant difference in the level of preparedness in terms of clinical safety, culture of safety, working as team, communicating effectively, management safety risk, understanding human and environmental factors, and recognize, respond to, disclose adverse event, and close call.
Differences in the level of preparedness as a whole and when grouped according to sex. The results indicate that there is no significant difference in the level of preparedness when grouped according to sex. According to Ramirez-Torres et al. 2023, they found no sex-based differences in patient safety culture perception among nursing students. Sex was found to have no significant influence on the preparedness of nursing students in clinical risk assessment and management.
Results and discussion. When grouped according to number of clinical exposure, the results indicates that there is a significant difference in the level of preparedness in terms of culture of safety and recognize, respond to, and disclose adverse events and close calls. According to Smith et al. 2018, exposure to diverse clinical experiences is crucial for enhancing the clinical preparedness of nursing students.
For the conclusion, the study showed that the majority of the participants were women, and those with 16 to 20 clinical exposures indicated a high level of preparedness in recognizing and responding to adverse event and culture of safety. It emphasizes the necessity of nursing education programs providing a diverse and comprehensive range of clinical exposure, ensuring that the students are prepared to meet the challenges of clinical practice.
For the recommendation for the health institution and facilities, collaborate to enhance nursing students' practical skills and clinical risk assessment and management. And for the College of Nursing to employ simulation exercises and engage in clinical partnership for diverse experience. And for the nursing faculty to develop their skills and support student learning.
For nursing students, to enhance their understanding of clinical risk assessment and management through trainings, simulations, and workshops. Active participation in clinical exposures help them apply theoretical knowledge to real-life situations, bridging the gap between research and practice. For patients, to engage with providers to ensure robust risk management protocols and provide feedback on nursing care to identify areas for improvement and enhance patient safety. Lastly, for future researchers, to identify preparedness gaps in nursing students' clinical risk assessment and management, to evaluate teaching strategies, and to use qualitative methods to understand student experiences.
Once again, this has been Group 4B of BSN 3C, and we thank you for listening.